Alexander disease and neuronal linkage. Most people think that brain diseases starts directly from neuron, but Alexander disease is different. In this rare genetic disorder, the main problem begins in the astrocytes, the supportive cells of the brain. A mutation in gFAP gene causes abnormal protein accumulation and formation of Rosenthal fibers. These damaged astrocytes fail to support neurons, disturb white matter, impair myelination, and disturb neuronal communication. This can lead to seizures, ataxia, dysphagia, developmental delay, and spasticity. Hi, my name is Dr. S, and today we're going to discuss Alexander disease. The key definition: primary cell-affected astrocytes, hallmark pathology, Rosenthal fibers development, and secondary effects included white matter damage, impaired myelination, seizures, spasticity, ataxia, and development decline. Disease overview: neonatal and infantile patients have severe developmental delay, seizures, macrocephaly, spasticity. Juvenile having different symptoms, bulbar symptoms, vomiting, ataxia, spasticity, speech and swallowing difficulty. And in adults, cerebral signs, ataxia, weakness, dysarthria, dysphagia, autonomic symptoms. Neuronal mechanism include the gFAP mutation, causing mutant gFAP accumulation, Rosenthal fiber development, astrocytes failure, white matter injury, and impaired neuronal communication. That causing the excitability imbalance due to the poor glutamate disclearance and reduced potassium buffering, conduction failure, myelin maintenance, axonal signaling, low distances, circuits, brainstem links, medulla brainstem's pathway, dysphagia, dysarthria, formatting autonomic system, and respiratory risk. Cerebral link, poor coordination and gait disturbance are the major symptoms. Therefore, Alexander disease present with development delay, seizures, spasticity, ataxia, speech, swallowing difficulty, cognitive decline, and progressive neurological dysfunction. Astrocytes neuron unit in Alexander disease, mutant astrocyte causing abnormal extra brain environment, decreased glutamate and potassium imbalance, neuronal metabolic support and myelination, and axonal support. These all four causes the neuronal dysfunction in the brain, which leads to seizures, spasticity, ataxia, dysphagia, and developmental and cognitive decline. Pathology include astrocyte dysfunction, Rosenthal fibers development, white matter damage, impaired myelination, and disturbed neuronal signaling conduction. Pathological features include accumulation gFAP and stress protein, represent astrocyte stress and disturbed protein handling. White matter changes, myelination becomes impaired. MRI also shows characteristic white matter changes, often frontal predominant in early forms. Neuronal impact, circuit excitability changes, brainstem and cerebral involvement contributes to swallowing, speech, autonomic, and coordination problems. Diagnosis include clinical examination, MRI, genetic testing, especially gFAP, and supportive assessment, EEG procedures, swallow assessment, motor therapy, evaluation, and respiratory and nutrition assessment. Differential diagnoses include leukodystrophies, cerebral palsy, mitochondrial disorders, metabolic white matter disease. And in adults, onset can mimic multiple sclerosis, ataxia syndromes, or brain stem cerebral disease. Treatment include the seizure control, physiotherapy, speech and swallow therapy, nutritional support, respiratory support, genetic counseling, and future therapy concept, especially with the gFAP. Supportive and symptom-based management, anti-seizure medicine, or uh, the basic treatment, and starting it from the physician starting it from the early ages of this patient. Pain and sleep support, therapy support, physiotherapy, swallowing therapy, speech therapy, communication support should be there. Medical support, nutrition support, pulmonary infections, hydration and constipation, palliative support, care planning. And lastly, gFAP testing, especially for the family. Prognosis, severity of white matter and brainstem involvement, seizure burden, swallowing, respiratory complications, nutrition support, and supportive care assessors. Emerging therapies are there, especially the gFAP, mRNA, uh, oligonucleotide therapy for the stoppage or reduce astrocytes stress and Rosenthal fibers pathology. Neuronal linkage. These are the few factors that are that should be stabilized uh, with the therapy and with the drugs that can physician can modulate these therapies so the patient gets stable. These include gFAP aggregation in astrocytes, poor glutamate clearance, poor potassium buffering, reduced metabolic support, white matter, myelin injury, uh, brainstem pathways, cerebral circuit involvement. And these are the neuronal effect of these decline features: astrocytes, cytoskelet stress, synaptic overexcitation, unstable neuronal firing, low neuronal resilience, slow or blockage conduction, bulbar autonomic circuit dysfunction, and poor coordination signal. That is the summary. Alexander disease is a GFAP related astrocyte disorder. Mutant GFAP accumulates and forms Rosenthal fibers. Astrocytes disturb neuronal support, especially the glutamate potassium regulation. Pathology include uh, Rosenthal fibers, astrocytes, white matter damage. Diagnosis based on features like MRI pattern and confirmation by gFAP genetic testing. Treatment including the sporting treatment, emerging gFAP lowering therapies are under investigation. Thanks and regards. Please like and subscribe this channel for further discussion on different diseases. Thanks.